Hi, good day. I'm Dr. Dean van der Westhuizen. I'm an eye specialist working in Mbombela in South Africa. And today I'm just going to chat quickly about diabetes and diabetic eye disease. This is a topic that the textbooks are written on, but I just want to give you a quick glimpse into the condition. So I'm going to focus on the retina. There are other parts of the eye affected by diabetes, but the retina is definitely the main source of the problem and one of the leading causes of irreversible blindness. If you look at this image, one can see that this is typically what a normal retina would look like. You can see the blood vessels coming out from the optic nerve, and the macular area is nice and clear. And if you look at the example of a diabetic retina, you can see all these spots of hemorrhages. Is what we call a cotton wool spot here, and exudates and leakage into the retina. And this is what starts to cause a problem with the vision. There's two main problems that we see on the retina. One is what we call diabetic macular edema, which basically means retinal swelling. If you take a look at this image, there's another fundus photo from a diabetic. You can see here's an area where fluid has leaked out, and with that fluid, proteins have been stuck in the retina, causing these white exudates. And if we take a scan through that area and look at it in cross-section, we can see this. Here's a normal little section where the retina looks healthy, but over here you can see that there's bubbles of fluid, these bits of proteins and a whole lot of stuff in the retina there. And this is essentially diabetic macular edema. If this swelling affects the central part of the retina, then the vision deteriorates significantly and we need to start treatment. And there's a variety of forms of treatment for that. But that's diabetic macular edema or diabetic macular swelling, which is the one thing that we're very concerned with in diabetics. So the other thing that we're worried about is what we call diabetic retinopathy, which essentially is a problem with the blood vessels. Over time, like everywhere in the body in diabetics, the microvascular blood vessels, so the very small blood vessels, whether they're in the heart, the brain, the feet, the kidneys, and the eye, start to become affected. And so they start to become blocked and clogged up, and you start to get lack of oxygen in that area. As you start lacking oxygen, your body starts trying to produce new blood vessels, and in the eye, that's done very unsuccessfully. And so as new blood vessels start to grow into the retina to try and provide oxygen and nutrients that the retina needs, those blood vessels start to cause damage in themselves. They start to bleed, they start to form scar tissue, and the retina starts to become lifted up, and you can get what we call a tractional retinal detachment. Here's an example of a patient with what we call proliferative diabetic retinopathy. You can see over here, if you look closely, here's a whole bunch of abnormal blood vessels. These are not normal. They don't normally look like, almost like a bush of vessels over here. There's some more over here. You can see all these abnormal vessels that have grown. And as a result, you've got what we call a fibrovascular complex. So you've got vascular tissue, and it's causing folds in the retina at this point. And this retina is at risk of detaching. So this is very serious. If this condition progresses, often these blood vessels can burst, and you start to get blood in front of the retina, sometimes under the retina, and into the vitreous or into the gel of the eye. It starts to bleed. And this is very, very serious, often requiring surgery, often requiring laser. The good news is that for both diabetic macular edema and diabetic retinopathy, we have fairly good treatments for both. The key is to ensure the right patient gets to the right doctor at the right time. So really, diabetic screening is critical. If you are diabetic, it's important to have an annual dilated fundoscopy so that one can review the retina and pick these things up earlier. We pick up diabetic macular edema or retinal swelling earlier, and we start treatment, we can make a dramatic difference to the vision and to prevent further progression. And the same with retinopathy. If it's picked up early and it's treated early, then one can limit the loss of vision that diabetics can suffer from. So it's not something that we should see often. Seeing patients with severe proliferative diabetic retinopathy with traction and bleeding is not something we should see. We see it far too often, and that is because patients present too late. It's really important to ensure that you're screening and monitoring and looking after your eyes. And obviously, on the background of all of this, sugar control is the most important thing. That is the source. it's the source of why all these changes happen. So controlling the sugar, ensuring that you have a general practitioner, physician, or someone who's managing your diabetes with you, having a dietitian, making sure you're looking at your diet, exercise, medication, etc., and watching your sugars closely is the key to managing all of this. But besides doing all of those things, an annual checkup is the least that a diabetic should do to ensure that they prevent what could be a potentially blinding condition. I hope that was clear and insightful, and thank you for watching.